Welcome back to the Deep Dive. Today, we're tackling a really big one, foundational nutrition.
Yeah, absolutely essential stuff.
This isn't just, another diet trend chat. We're aiming for a deep, structured look at fuel, the body's complex systems. Basically how everything works from food intake.
It's kind of the ultimate guide to understanding your own body, really. We've pulled together sources that give a clinical perspective on requirements, those critical lab values.
Which we'll definitely get into.
Right, and how needs change, through life, across cultures.
Our goal today is to cut through the noise, give you a solid framework for how food impacts health, and, well, how poor nutrition contributes to disease. Super important info, whether you need it professionally or just for yourself. Okay, let's unpack this.
So first things first, the definition. Nutrition fundamentally is the study of food, right? How it affects the body, how it influences health.
Simple enough start.
But the core process underneath it all, that's metabolism.
Ah, metabolism. Not just calorie burning, though, is it?
Not at all. It's the whole conversion process. Taking food, breaking it down, converting it into energy the body can actually use, and then getting that energy out to every single cell.
Okay, so that conversion process is where the importance really lies.
Exactly. Our sources really hammer this home. Good nutrition is, well, it's essential for wellness.
And the flip side.
Poor nutrition, unbalanced diets. They're a major factor in a lot of chronic diseases. So getting accurate, detailed info, it's not optional. It's critical for health management.
Couldn't agree more. So let's start breaking down the fuel itself. The body needs different things for growth, maintenance, just basic functioning. Two main categories, right?
Yeah, we split them based on, well, how much you need and what they do. It's about fuel versus regulation, essentially.
Okay, so first up, the macronutrients.
Right, the big ones.
These are the energy providers.
Yeah.
Carbohydrates, protein, and lipids, or fats. They supply the actual energy measured in kilocalories, the bulk of what we eat.
Then you've got the micronutrients, vitamins, minerals, trace elements like zinc, copper.
Smaller amounts needed here.
Much smaller amounts. And the key difference, they don't provide energy. 0 calories.
So what do?
They're like the mechanics. They help manufacture, repair, or maintain cells. They're cofactors, helping the metabolic engine run smoothly. Essential tools.
Got it. Macros for fuel, micros for regulation. Let's dive into the macros first.
Sounds good.
Starting with carbohydrates. Carbs get a bad rap sometimes in diet culture.
They really do.
But biologically, they're the body's preferred primary energy source.
Absolutely. And here's a key point. Carbs provide almost all the energy the brain needs.
Wow. Okay, so the brain is really dependent on them.
Very dependent. It runs primarily on glucose. So when you think quick energy, think brain fuel and muscle accessibility.
And we talk about simple versus complex carbs.
Right. Simple sugars digest fast. Complex ones, like starches and fiber, take longer. But their main job is energy for muscles, organs. And they digest quicker than protein or fat. They're the default.
Default power setting. I like that. But what happens if you don't have enough carbs, like in starvation or a keto diet?
Well, the body has a backup plan, but it's not ideal. It's forced to switch to using protein and fats for energy.
Which sounds okay, but
it's less efficient. It can mean breaking down vital muscle tissue for fuel, which you really don't want. And it creates metabolic byproducts that aren't great long term.
Okay, so carbs are primary for a reason. Moving on to the next macro, protein.
If you take water out of the equation, protein is the biggest component of your body.
Really? More than fat?
Structurally, yes. Its main role isn't energy, though it can be used for that. Its primary job is tissue building, maintenance, structure.
And proteins are made of amino acids.
Exactly. Complex molecules built from these smaller units. And we categorize amino acids based on whether our body can make them or not.
Which leads to essential versus non-essential.
Right. Essential amino acids. The name says it all. Your body can't make them, or not enough of them. You have to get them from food or supplements.
You consume them to get them. Period.
Precisely. Then the non-essential amino acids. Still vital, but the body can synthesize these itself from other stuff. So dietary focus is mainly on getting those essential ones.
This brings up complete versus incomplete proteins. What's the deal there?
Simple distinction. A complete protein source, think meat, eggs, dairy, usually contains all the essential amino acids your body needs.
And incomplete.
Missing one or more essential amino acid, often found in plant sources, but this is key, you can combine them.
Ah, the synergy thing.
Exactly. The classic example is peanut butter on whole grain bread, or beans and rice. Combine 2 incomplete proteins strategically.
And you get a complete protein profile. covering all your essential amino acid bases.
You got it. It's a smart way to ensure nutrient density, especially on plant-focused diets.
Okay, rounding out the macros, lipids, fats. Often demonized, but essential, right?
Absolutely essential. Their role goes way beyond just energy storage. They supply essential fatty acids for brain health, nerve function.
Our brains are mostly fat, after all.
Good point. They also form cell membranes. And yes, they are that long-term backup energy source when carbs run low.
What's fascinating, like the source says, is that dual nature, indispensable, but sometimes in excess. Major health hazard
That's where the clinical monitoring comes in. It's crucial.
because of the cardiovascular risk.
Precisely. The sources highlight this danger zone. High BMI, high LDL, that's the bad cholesterol.
Low-density lipoprotein.
Right. And low HDL, the good high-density lipoprotein, that combination. It significantly ramps up your risk for type 2 diabetes, heart disease, and hypertension, or HTN.
Spotting that pattern is key for prevention.
Absolutely central.
Okay, that covers the big energy providers. Now let's zoom in on the regulators of the micronutrients in water, starting with vitamins.
Vitamins are interesting because how the body handles them, whether they dissolve in fat or water, dictates how often you need them and the risk of getting too much.
Makes sense. So first type.
Fat-soluble vitamins, A, D, E, and K. They dissolve in fat so the body can store them, mostly in the liver and fat tissues.
Which means you don't need them every single day.
Correct. Your body keeps a reserve. But that storage capacity is also why they carry a toxicity risk.
Hydrovitaminosis.
Exactly. If you take high-dose supplements over long periods, they can build up because the body doesn't easily flush out the excess.
The mnemonic our source suggests is all dogs eat kibble.
Ace.
Let's quickly touch on sources and functions.
Okay. Vitamin A, good for vision, found in yellow fruits, leafy greens. Vitamin D, crucial for calcium absorption from sunlight, fortified milk.
E.
E is a key antioxidant found in vegetable oils, nuts. And vitamin K, green leafy veg, and absolutely critical for blood clotting, hemostasis.
Okay, so 80 key are stored, potential toxicity. What about the others?
Water-soluble vitamins, that's
Yeah.
vitamin C and the B complex group, they dissolve in water.
Meaning the body doesn't store them.
Right, any excess is pretty quickly excreted by the kidneys, flushed out in urine.
So you need these every day.
Every single day, need a constant supply. The mnemonic here is take your birth control with water, B and C.
Sources for these.
B-complex vitamins are in dairy, meat that are involved in tons of metabolic processes, energy production especially. Vitamin C, famously from citrus fruits, boosts the immune system and really helps absorb iron from plant foods.
Good tip. Okay, next up. Minerals.
Minerals, naturally occurring elements essential for, well, everything from bone health to nerve signals.
How do we classify these?
By how much we need. Major minerals or macrominerals are needed in larger amounts, 100 milligrams a day or more. Think calcium, magnesium, phosphorus. They often form structures or manage fluid balance.
And the others.
Trace minerals, needed in tiny amounts. Copper, fluoride, iodine, iron, zinc. They often act like catalysts, helping enzymes do specific jobs.
The functions are broad fluid regulation, nerve impulses, energy. But let's focus on a few key ones with major health links.
Definitely. Where should we start?
Let's start with calcium. Obvious one for bones and teeth, right? Most abundant mineral.
Absolutely. Sources like broccoli, dairy, and the impact is huge. Getting enough calcium throughout life really lowers your risk of osteoporosis later.
Okay. What about magnesium?
Magnesium's a big regulator, crucial for heart rhythm, nerve function, muscle function. You find it in whole grains, legumes, nuts.
And the risk link.
Deficiency is linked to higher risk of hypertension and heart disease, especially in women, shows its role in vascular health.
Interesting. Moving to electrolytes. Potassium K.
Vital, regulates blood pressure, essential for muscle contraction, including the heart muscle, found widely in fruits, veggies, meats.
Is the risk here deficiency?
Deficiency can be an issue, but excess potassium hyperkalemia is a major concern. Too much messes with the heart's electrical signals.
Oh, seriously.
Can cause dangerous cardiac dysrhythmias, potentially fatal abnormal heart rhythms, so balance is key.
And the counterpoint to potassium is sodium.
Right, main job, water balance, osmotic pressure. Sources, everywhere in modern diets, processed foods, table salt.
And the problem with too much.
Sodium pulls water. High intake makes the body retain fluid, increasing blood volume. The direct result is increased risk for hypertension, heart attack, stroke. It's a clear link.
Lastly, for minerals. Let's hit iron.
Key function, making hemoglobin. That's the protein in red blood cells carrying oxygen.
Sources like spinach, red meat, fortified cereals, and deficiency leads to.
Anemia. Very common, especially globally among women and children. Reduced oxygen carrying capacity.
Okay, we've covered the solid components, but none of it works without.
Water, the essential medium, makes up about half our body weight, maybe a bit more for men.
And its functions are just fundamental.
Totally. It transports everything, oxygen, nutrients, waste. It's the medium for chemical reactions, regulates body temperature through sweat evaporation,
And you have to replace that lost fluid. Dehydration impacts everything.
compromises every single system we've just discussed.
Right. So we know the building blocks, the regulators. How do we figure out someone's actual nutritional status? How do we measure this stuff inside the body?
Yeah, it's complex because needs aren't static. So many factors influence them, like developmental stage infants, pregnant women, elders all have different requirements.
Lifestyle plays a role too, right? Education, caffeine, food for coping.
Absolutely. And ethnic, cultural, religious practices are huge. They often dictate dietary staples or restrictions. Plus, disease processes, physical limitations like trouble chewing or swallowing.
And medications, they can seriously mess with appetite or nutrient absorption.
Exactly. So the assessment starts with some basic physical measures. Our sources point to BMI, body mass index.
Height and weight calculation.
Right. And waist circumference. That's a big indicator of abdominal fat, which is linked to health risks.
And you gather more detail.
Yeah, a thorough screening looks at appetite changes, bowel patterns, meds, activity levels, allergies, any history of indigestion, heartburn, gas.
Trying to get the subjective picture.
Also checking basics like ability to chew, swallow, taste, how many meals a day, fluid intake.
All of that. And to get more formal dietary info, we use specific tools.
The 24-hour recall trying to remember everything eaten yesterday. The food frequency questionnaire asks how often you eat certain food types. And the most detailed, the food record, where you actually log everything you eat for several days.
These give patterns, but for current status, especially protein and metabolism, we need objective lab data.
This is where it gets really interesting.
Let's talk lab values, hard evidence, starting with blood glucose.
The key measure for energy regulation, mainly carbs. We look for abnormal markers. Hypoglycemia, low blood sugar, under 50 milli-GDL. Often means not enough food or maybe too much medication like insulin.
And high blood sugar.
Hyperglycemia, that's over 127 milli-GDL random or over 109 fasting. Often points to diabetes or another endocrine issue affecting insulin.
Okay. Next, the protein markers. Albumin and prealbumin. You said the difference is crucial.
Absolutely crucial for understanding current status. Albumin is the most common protein in blood plasma. Low levels can indicate chronic malnutrition or absorption problems. But it has a long half-life, weeks. So it reflects nutritional status over the past month or so, not what's happening today.
So it's a lagging indicator.
Exactly. Prealbumin is the one you want for current status. It has a very short half-life, just 2 or 3 days.
Meaning it changes quickly.
Daily. It fluctuates rapidly in response to stress, infection, or sudden diet changes, especially protein intake. It's the body's immediate feedback signal for clinicians.
Much more sensitive marker. Got it.
Yeah.
Finally, the cholesterol panel.
Right, not just one number. It's a group of lipids we monitor together for heart risk and how the body's handling fats.
That's included.
Total cholesterol, triglycerides, fats circulating in the blood, HDL, the good cholesterol that clears things out, and LDL, the bad cholesterol that can build up in arteries.
And the balance between them is key for predicting risk.
Precisely. Predicting risk for hypertension and heart disease.
Okay, so that's assessment in labs. Now, let's talk about when standard diets don't work. Special diets, feeding issues.
Right. We mentioned culture and religion always need consideration. But sometimes medical needs dictate specific modifications for safety or treatment.
This is the spectrum of modified diets, starting with the baseline.
Standard diet or regular diet, basically no restrictions.
Then things get modified based on consistency or content.
Yep, often starts with liquids, clear liquids, broth, gelatin, things you can see through, used right after surgery, severe GI upset to rest the gut.
Next step up.
Full liquid. Transitioning towards soft foods, or maybe for acute gastritis, includes opaque stuff like milk, smooth soups, ice cream.
Then even smoother.
Blenderized liquid or pureed, essential if someone had facial surgery, has their jaw wired, or just severe chewing problems. Everything's smooth, same consistency.
We also adjust fiber, right?
Yeah. Soft mechanical or low fiber diet, another transition step. And then high fiber diet, pushing whole grains, fruits, veggies to help with bowel regularity.
What about when someone can't eat at all? NPO.
NPO, nothing by mouth. If that goes on for more than a few days, malnutrition is a huge risk. They need nutrients some other way,
Wow.
usually glucose and electrolytes through an IVF, intravenous fluids. For longer term, more complete nutrition, it's TPN, total parenteral nutrition.
That sounds serious.
It is. TPN bypasses the gut entirely, delivers everything, calories, protein, fats, directly into a large vein. High risk, very intensive.
Okay. What about diets for swallowing problems, dysphagia?
That's a critical category, therapeutic diets for dysphagia. Swallowing difficulty means a high risk of aspiration food going into the lungs.
So the liquids need to be changed.
Absolutely. They have to be thickened to slow them down, make them safer to swallow. There are specific measured levels.
Yeah.
Thin, nectar thick, honey thick, and the thickest spoon thick like pudding.
Consistency is a safety measure.
A life-saving one.
Yeah.
Which brings us to actually feeding someone with impaired swallowing. Safety protocols are mandatory here.
Like positioning.
Non-negotiable. Head of bed, HOB, must be at 90 degrees sitting straight up during feeding. Feed small amounts slowly.
And afterwards.
Keep the HOB elevated, maybe 30 to 45 degrees, for at least 30 to 45 minutes after the meal. Helps prevent reflux and aspiration, and you have to watch constantly for any signs of trouble.
Makes sense. We also need to touch on older adults specifically. Their needs change, right?
Definitely. Key physiological changes happen. First, the metabolism slows down, so their overall caloric needs decrease.
They need less food energy.
Generally, yes. But they also often experience decreased sensations. Their thirst sensation can diminish, putting them at high risk for dehydration.
And taste.
Taste and smell often decrease too. This can unfortunately reduce appetite, make food less enjoyable, and lead to them not eating enough.
Finally, what about dealing with nausea? Common issue.
Very common. Non-drug approaches help. Cool cloths, ice chips, sips of cool water, offering bland foods, crackers, toast, and if needed, antiemetic medications prescribed by the doctor.
Okay, wow. We've really covered a lot of ground. From the big energy sources macros through the tiny regulators, micros, and water, all the way to measuring status with labs and handling special dietary needs.
It really paints a picture, doesn't it? Nutrition isn't vague. It's incredibly specific and measurable within the body.
So what does this all mean?
It means every choice matters. Like we saw with potassium and sodium, the balance of those trace minerals directly impacts huge things like heart function and blood pressure. It shows that connection is real and quantifiable.
And thinking back to that sensitive lab marker, pre-albumin, the one showing current status because it changes daily.
Yeah, that rapid turnover highlights the immediate feedback loop the body provides.
So here's a thought to leave you with. Given that pre-albumin reflects our current nutritional state so quickly, what small daily habits, maybe related to protein intake or managing stress, do you think might have the most immediate detectable impact on your own wellness markers, even within a week?
It makes you think about that immediate connection between action and biological result, doesn't it? Something to consider.
Absolutely. That's all the time we have for this deep dive.
Thanks for joining us on the deep dive. We'll explore more data next time.